healthcare is undergoing a lot of transformation. And so I know PWC views it as a new health economy. And so I'm wondering, what do you mean by that term? How do you guys view it? It sounds straightforward, but obviously it has a very specific meaning to you. How do you view it, and what are you seeing out there in the industry that led you to this term?
Sure. So we think of the new health economy as money is moving in a different way. We have a consumer now who has more dollars at stake for the first time, whether it's through a high deductible plan or the fact that they're purchasing insurance on the exchanges. So we also see a shift on the payment side, right? Medicare has said we're going to start paying for value. That's a big shift from when we were paying for volume. So as we look at that, we say money begins to move differently in this new health economy. It also is driving change, right? Because people move where the money goes. So in the new health economy, the rise of the consumer means we have a much stronger B2C model evolving, where before the patient was simply that, a patient, not a customer. So that's one of the big drivers. We also see new entrants coming into the new health economy and disrupting it. We're having conversations with all kinds of companies. Most specifically, we see a lot of traction from Walmart and Walgreens saying not only are we going to do pharmacy, but now we're getting into primary care and we're extending our reach because we believe we can take parts of this economy and turn it into a much stronger consumer-based model and drive change. So for the new health economy, money's moving differently. It looks like a more normal B2C economy, and we see the drivers of change around paying for value and working to the consumer as the big draws.
In terms of the new sort of health economy that you're seeing, is data a real big driver to that?
Yeah, listen, I think data, but data that becomes information. So the point that you're making, there's a lot of data in the system, but it's how we use the data and where we're going to activate. And the first thing the customer wants, especially the millennial customer, they want transparency. They want to know how conveniently can they get to their information or their data, how quickly can you activate a solution around the data when they see it. We're seeing tons of collaboration now and talking about managing populations of care. So for the payers and providers, having those walls between the claims data and the medical data, it doesn't work anymore, because if you're going to pay for value, and value happens over the length of an episode of care or a condition, you need to bring all that information together. So data underpins a lot of what we see. And we're going to get more and more consumer level data when you think about where pharmacy is going, when we think about precision medicine and targeted therapies and cancer. We've got to get to a platform that enables all this data to come together, and then we put the transparency around it to get it to the right places.
Looking back over the past year, how do you see things having evolved? I mean, what's sort of been the biggest evolution in terms of healthcare over the last year in your eyes?
Yeah, I would give that sort of two lenses. One is we had already talked in the past about convergence among the players in the system, but I will tell you the lines between payers and providers have just become completely blurry at this point. You have both sides saying we're ready to take risk. We are ready to move into a consumer, facing market. Neither one, by the way, has total brand permission with the consumer. They're not as trusted as they would like to be, but I see the lines getting really blurry, so a lot of new business models coming into play. And the other thing that I think is helping to change that system is the employers. Don't leave employers out. 46%, right, of the volume in this market comes through employers, and they're actively looking at what are the best wellness incentives that we can provide. How can we partner with different networks? When you've got Walmart saying we're going to send our cardiac patients to the Cleveland Clinic and narrowing that network, to me that's really beginning to take this notion of healthcare as a local industry and explode that concept into we're going to go for the best value and convenience for our people.
What hurdles do you see that are still in place to sort of reach those goals that you're just talking about? What hurdles do you still think need to be overcome?
Yeah, I think we're still in a heavily regulated industry. I think HIPAA and privacy and security are big concerns. And I think we're behind on infrastructure. There's no question that it's an industry that always invested in medical technologies and strong therapeutics, but we didn't invest in the back office. We didn't invest in the things that are the customer interface that you would expect, right? How easy should it be to register? When you get your explanation of benefits, it should be something that's legible to a consumer, but we didn't invest there, so we're behind. So the regulatory environment and some of the basic investment we need to make are big barriers at this point.
Do you think the government can play a role in sort of incentivizing change in that space? I know it's sort of been one of the drivers of, some incentives when it comes to like electronic medical records and things. The government's been supporting that with incentives. Do you think incentives need to be part of that equation?
I think they almost have to be, right? Because you're putting an industry in transition, and you've got to think about sort of I call it 1 foot on the gas, 1 foot on the brake. So if you incentivize some of these behaviors, it helps those systems move, because you need to change into a value-based equation. So you put the incentives out and you have people move to those, and then you can ultimately take those down and make it more table stakes and how you react. And look, the government's the biggest payer. No matter what, they're the biggest customer in the system today. So where they go, the other payers follow.
Within this new health economy that you view, what isn't necessarily getting as much attention that you think deserves more attention?
You know, I think that I'm curious to see, as we put more and more choice out to consumer, who's going to be the Amazon of the industry, or the Consumer Report? Who's going to help me channel through all of the choices that are going to be out there, the apps, the opportunities of places I can go? And I think it's going to be an unexpected player. I believe it'll be a new entrant. And I think it's going to turn some people's heads, because you'll feel like you have a market locked up. But then if there's a TripAdvisor that says, well, actually the wait times at this place are lower, or you can go to that market or Walgreens type clinic and get your care, that to me is the piece that's missing yet. Who's going to come in and array that information in a way that the consumer can't access? And we will shift where loyalties sit and where sort of patient direction goes.
It's a very interesting point. I think everyone thought Google might be a big player in this, and they entered and then they sort of retreated. And then Apple sort of stepping in, but more with just sort of a more consumer-facing, app technology, but not necessarily in sort of the big way, like the Amazon level of sort of, involvement that people are sort of expecting. And you look at the industry, it's still sort of fairly fragmented in terms of who's the player that's going to have the solution that everyone sort of, runs to and becomes the Google or the Apple with the sort of digital healthcare.
I think it's going to start to evolve, and I think some people are waiting to see. But look, if you believe that there's $1 trillion of waste in the healthcare system, and maybe that number is even higher, somebody's going to monetize that waste. And we truly believe the new entrants are going to take a big swipe off the top of that, just as you suggested, through an Amazon model, through a model that arrays these players in the industry in an unexpected pattern.
Where do you see sort of interoperability among all the players that are out there? Do you think there's enough interoperability now that it'll start to happen, or do you still think we have a little ways to go with interoperability, especially in terms of the data?
I think we have a ways to go in terms of interoperability. And I agree, we had some conversation earlier today, but you got to get to the cloud. Right, we have to be able to work through, if financial services can fly all of your transactions, right? If you're like me, I'm banking through my iPad these days. I deposit my check that way. If all of that information can lock up and be interoperable, health should be able to get there. But I don't think, we don't have the technology investment that we need, and we have to work past HIPAA and privacy and security to get to those cloud-based solutions that are going to enable that.